Welcome back, everyone, to another episode of the Preventive Medicine Podcast. I'm Dr. Raghav Sharma, and this podcast, we just get heavy-hitting guests. I don't know how they agreed to come on the show, but week after week, we have actual experts talking about things that are deeply important in preventive medicine. This week is no different. We have Dr. John Whyte, who is actually the newly appointed CEO of the American Medical Association. And for those that might remember who have been around for a while, he was actually on episode number 3 of this entire podcast, way back when, so I'm excited to have him on again. As more of a little bit of a continuing intro, he's not only the CEO of the AMA, but he's had a track record of doing impressive things in the medicine space, kind of in the public sector as well. So he graduated, he's a board certified internal medicine physician. He's been at the FDA as a director. He's been at the Centers for Medicare and Medicaid. He's been at the U.S. Department for Health and Human Services. He was also previously the CMO for WebMD, which is when I first had him on the podcast. And now he is the newly elected CEO of the American Medical Association. Dr. John Whyte, welcome to the show.
Thank you for having me. As we said a little while ago, I can't believe it's been 5 years. You have accomplished quite a bit during that time as well. So kudos to you.
It has definitely been a while. I'm excited. Let's do this. Overcoming saber-toothed tigers and woolly mammoths, we must now face a new enemy, ourselves. With the rates of diseases such as heart disease, stroke, diabetes, depression, and many others ballooning, we must find a better solution to these modern epidemics. Welcome to the Preventive Medicine Podcast. We believe in building a foundation of health by means of prevention so that you can build the life you want and find fulfillment with no barriers. Hear from experts around the country on how to take your health into your hands. Take control and build a foundation of health for the life that you want to live. And now, here's your host, Raghav Sharma. We hope you enjoyed the show, and if you do, please don't hesitate to subscribe and like for all of our future content. All right, I am extremely excited to get into this, and I was just watching back our previous episode that we had to see what some of your answers were, and things have changed a little bit since back then. So let's see if some of your answers have changed. I'm not going to quiz you on them. The first one always is, what does preventive medicine mean to you?
Sure, and hopefully my answers are fairly consistent. But I think preventive medicine, as its name implies, really is focused on the prevention of disease. And as I'm sure we talked about, there's really a misperception that most disease is genetic. And the reality is more than half of diseases are caused by lifestyle. So if we focus on that, if we focus on maintaining health, preventing or slowing down the progression of disease, that's what preventive medicine is all about.
Definitely. There's a lot that goes into that, and we don't have time to kind of dive fully into it. If you all want to check out his previous answer, you can go way back to episode 3. I think he actually had like a 5 or 6 minute long answer last time.
I talked longer then, and it was
things have gotten a little brief since then because times are a little bit busier now. Yeah. So the American Medical Association is pretty well known to physicians as far as engagement, what you guys do. But for those listening to this podcast, what kind of is the overarching mission of the AMA, and who does it serve?
And I hope you're a member. If not, I'm going to follow up with you afterwards. But, just for perspective, the AMA has been around since 1847. And there aren't a lot of organizations that can boast that longevity. And I think we have that because, our motto is the art and the practice of medicine and the betterment of public health. So it's all about, our legacy has been the training of physicians, the education of physicians, and how we help create a system that promotes training people like you, highly qualified physicians that practice medicine. It's about our advocacy efforts that advocate for physicians, that they're paid fairly, that, we have a system where we can reduce prior authorization, where the physician can really lead healthcare. It's all of those things, and even how we think about the health of patients. So, I'm very excited to be leading the AMA, especially at this time.
Definitely. You mentioned several things as far as advocacy that the AMA is kind of involved in on several fronts. As far as preventive medicine goes, is what kind of actionable things or things that you do promote preventive medicine in that space?
Well, we have always been a big supporter of the U.S. Preventive Services Task Force, and that has been in the news lately in terms of their recommendations. So that's one important element of always supporting the science. We have always been big supporters of screenings, particularly as it relates to cancer screening, relating to screenings of cholesterol, really focus on this evidence-based approach, not just to acute care, but about preventive medicine as well. And then, we have this great little media blog that we use is What Doctors Wish Patients Knew. And a lot of it, Raj, is around preventive issues of, salt in the diet, how one can think about managing sleep better. So there really is a key interest in preventive medicine at the AMA.
Definitely. And I know we said we had 30 minutes for this. Obviously, we could talk for a long, long time about what's going on right now. You mentioned the U.S. Preventative Services Task Force. For those listeners who aren't aware, there have been some recommendations made to remove members of that organization and a bunch of other different things that are going on. So I guess that kind of leads into the challenges that we face in today's landscape as far as medicine goes. What does the AMA identify as the biggest challenges that we have kind of today?
Yeah, and we really know this by surveying physicians, both members and non-members. Much of it is about administrative burden. And you know this, the amount of time that you have to document in the chart, the issues of prior authorization, which really are excessive. And many insurance companies, actually, people are incentivized to deny or delay care. And that's a big issue. There's issues of scope creep, people practicing in an area where their license really doesn't allow them to do, and not having to go to the rigorous training that we do through medical school and residency. Certainly, the Medicare payment schedule is a challenge. We want physicians to be able to be paid fairly. And, a big issue going on right now is the number of physicians that are being bought up by private equity or healthcare systems. And it's very hard to be an independent physician. So we really have to reset that playing field and level it. I mean, those are just kind of the first, 4 or 5 issues that come to mind when we talk about, what are the biggest issues facing us today.
Yeah, I don't envy you. There are a lot of issues, unfortunately, in medicine. It's an interesting time for myself to be coming into a practice of what kind of sounds like been a lot easier to practice medicine than where it is today. And those are just 5 of the challenges that you mentioned that are kind of on our day-to-day basis, things that affect us. However, unfortunately, we're seeing things that affect kind of the fabric of medicine itself, as far as you mentioned, being evidence-based, following guidelines, recommendations made by panels and literature. Can you speak a little bit about like the challenges that we're facing kind of on a macro level versus what we face on a day-to-day basis?
I think part of it is the trust in the medical community. We've seen a lack of trust in government agencies in terms of how people view the FDA and the CDC, which were traditionally these, most well-respected
Bastions.
entities. Right. In terms of the profession of medicine, people think that, we're owned by pharma, or that, we're just about making money, which you and I know is not the reason why we went into medicine. And then we basically, with social, even in the 5 years since we last talked, the number of influencers that talk about health topics and give advice, and you think they have no expertise. And I've seen people that have had harm following advice that they did, from a reel on Instagram or other platform. So that's one of the biggest challenges: the misinformation, the disinformation, and that certainly is something that I think is going to get worse before it gets better.
Yeah, you mentioned this lack of trust, and it's seen on all fronts, not only in individual physicians, as far as you're seeing, like we're peddlers of just pharmaceutical products and whatnot, but also in institutions that have typically been bastions of healthcare, like protectors kind of, and that we honestly, as physicians and as consumers, look towards for guidance. What do you think we can do about that lack of trust? Is this something that just has to be fully broken and rebuilt up, or is there something
Yeah.
we can start to do to try to repair cracks?
Part of the problem is physicians haven't been the best communicators. We don't spend a lot of time with patients. We talk down to patients. Traditionally, it was, I'm the boss, you listen to me. And that's not the case anymore. It's really this aspect of shared decision making, this aspect of really engaging with the patient. And we might have talked about this last time 5 years ago from my old life. Knowledge is power, right? But it has to be the right knowledge. And what we used to say at WebMD that I'm still a big supporter of is that better information leads to better health. But how do we get them that better information? So we have to be able to also provide information to patient in ways that they can understand. That's partly sometimes why they go to other people on social media, because they seem to be talking their language, right? So we have to be able to do that. We have to explain it in simple ways that they can understand without using a lot of medical jargon. And we have to be respectful of people where they're at. It's this idea of somehow you need to take this medicine. Okay, bye. We have to help explain it to them and why they need it, and then revisit it and give people an opportunity to ask questions. And that's some of the problems of the system that, we have 15, 20 minutes with a patient. You can't get a lot accomplished in there. And there's a push to see more patients during the day. So we have to address those systemic issues as well as how we interact with patients.
Lots of good points you brought up. I think 100% it's about that shared decision making. I think in my clinic, in my treatment room, I always kind of present the options and ask the patient, what do you think? Where are you at? How would you like to proceed kind of with this?
I do the
But
same thing. I ask them what's on their mind. I ask them, what do they think they have, right? That's really why they're there. They have something on their mind. That's why they come in nowadays
exactly.
to the doctor visit. And nowadays, people are going to ChatGPT. We used to say, they went to WebMD or elsewhere. Now they've looked things up on ChatGPT and they want to tell me their diagnosis. And I'm okay with that because that opens an opportunity for discussion. And that's how we restore trust, that we listen to them, we hear their concerns, and then we engage them with shared decision making.
Yeah, you touched on ChatGPT and AI in general, and obviously the AMA has been engaged in different things relating to AI. We'll touch on that in a little bit. The other thing you mentioned kind of going back is those systemic and kind of policy things, because it's difficult to kind of communicate with the patient if you do have 15 to 20-minute appointments. And that's kind of a systemic policy thing. So as far as the AMA goes, what does the process actually look like for changing those? Like, how is the AMA getting involved in making it so that we're not reimbursed solely for seeing more patients over time and that we can actually spend more quality time?
Yeah, and as you may or may not know, we have a whole policymaking process where we have a House of Delegates, where people are elected by their state and specialty societies and come together twice a year to really debate in a democratic way what are the positions that the AMA should take. And then it's a board of trustees and a management team that I lead that helps implement those policies. So that's a great democratic process that I would encourage physicians to learn more about. And I'm spending time in Washington today. I split my time in Chicago, Washington, D.C. Part of it is also focusing on the science, as we talked about, and the process, right? And being data-driven. So it's not a personal opinion, but I talk about how many patients physicians can reasonably see in the day, right? How do we measure quality of care? What do we mean when we talk about value-based care? And what are the measures for that? So policy has to be evidence-based, and that's a strong focus of mine, and done in Washington in a nonpartisan way. And I can truly say we are nonpartisan. We have worked with members of both parties over the last 175, 185 years to enact what's going to work best for physicians and patients, and that's the way it should be.
What does that process look like when you said, so we understand the democratic process, it comes to the AMA, you kind of take up a policy statement as far as the AMA, what we think is best. How does that translate to the actual law or what like Centers of Medicare, Medicaid, all those people implement? What does that kind of gap look like in there?
And that's about engaging with the administration, who was ever in the White House. So even just a couple of weeks ago, I was over at CMS meeting with the administrator, the deputy administrator, the head of the Center for Medicare and Medicaid Innovation, talking about what some of those policies are. So lots of times policies are broad statements, right? And then you have to go through what's going to make that happen, and a little bit in the weeds, which is very much DC based. So it's about working with them, whether, for instance, now the Medicare fee schedule, they put out a proposed rule. There's lots of comments that you have to develop and work with the administration to get your perspective in. It's the same thing on the congressional side in terms of legislation, working with members of both parties to get a bill passed and get elements in the bill that are important to physicians.
Obviously, I myself have no experience with that kind of process as far as what the engagement looks like. But is this something that policymakers, lawmakers, and those kind of in those positions are receptive to? Or is this something like, oh, these people are talking about this, whatever, we'll do our own thing?
I think it's a little bit of both. Depends who you're talking to. Everyone's not receptive to different ideas, but I think certainly in DC, it's a lot of give and take, right? It's about compromise, and some people don't like compromise, and there's some things you won't compromise on, and other things that you need to get certain things done. So it's a little bit of a dance, to be honest, in terms of the strategy. But what's so important is you have to think about what your priorities are and what do you want to accomplish in the short term and the long term, and then have a strategy to do that. And in Washington, there's a lot of bumps along the way. So, you know, I would be naive to say that people just come in and embrace and tell me all your good ideas and then adopt them, because that's not how it works in anything. So it's really about negotiation, but negotiation that's really backed by data, by science, by what's going to advance the art and practice of medicine. That's what's so important.
For sure. It would be amazing if kind of everything that physicians and patients wanted could just be adopted just like that. We didn't have to do that dance, obviously, but
That would be nice.
that's what you're there for. And that's what the leadership of the AMA is there for. One of the things that you mentioned as far as compromise goes that we probably shouldn't compromise on or don't want to be is misinformation, which unfortunately we've touched on is getting more and more rampant through a variety of channels, whether social media or now with the rise of AI, ChatGPT, all these things. One of the things that's kind of one of my personal reflections, reading more about kind of the development of a lot of these models, is that they scrape random information kind of from across the internet. And unfortunately, the brains of physicians are not on the internet. So ChatGPT is not scraping these things. It's not getting fully educated on what's there. So unfortunately, there's a fair amount of misinformation out there, even in ChatGPT or whatnot. How does the AMA combating this misinformation, or are there kind of initiatives or things that you're doing to work on that?
I love how you're taking time to read, because I didn't have too much time in residency to read.
It's just during driving. It's just audiobooks when driving.
Yeah. And that's good. So we have principles relating to the use of AI across the different strategies. So it is about that, there has to be transparency in terms of how you just talked about, what's the data that algorithms are tested on? How do you know that you are minimizing bias in terms that it's a representative data set of the population that you're going to serve? There are a whole bunch of elements and criteria that we have in terms of an AMA AI action plan that people should look at and think about. And then, obviously, in terms of misinformation, I love how we talk about AI as augmented intelligence. It's there to help and aid physicians, not to replace physicians. And that's an important component. And then for misinformation and disinformation, we really have to help educate the public. How do you look at information? Who's the presenter, broadly defined, of the information, and what's their bias? And you and I might have talked about this a few years ago. What I say to people is, I wish they would consider health information like they do banking and investment information. Right? You don't just listen to any influencer or any idea about someone that tells you to invest in something. What do? You look to see who that person is, who their what their credentials are, right? Like, I'm not just going to listen to a random person that I don't know about investing my money.
Mm-hmm.
You're going to look to see if this is corroborated elsewhere. Does it make sense? You do all that due diligence, as you should, because it relates to your money. But when you comes to your health, your most important commodity, I find that a lot of patients are like, well, what's the harm? Why not? Why not try it? And that's where I think we have to help people reset their perspective. There's a reason why you and I went to medical school. There's a skill set that we've learned. Chat GPT, we get tired of hearing that it did well on the MCAT or it did well on a board exam. That's not the practice of medicine. Most people want to talk to a physician, but let's be honest, in some areas of the country, it's a long wait. So we have to be able to address this all holistically and comprehensively.
Yeah, you mentioned a couple things. One of them being the difficulty of kind of patients talking with physicians and getting access to them, and then kind of taking things into their own hands, whether it's getting information from online, wherever it is, and not kind of understanding the risks that could be associated with it. And I think, as like kind of the Hippocratic Oath, the first do no harm. One of the reasons that physicians are kind of less trusted is that we never seem to be certain about anything. We will say, well, it could be this, it's likely this, but we never say it's this, especially when we're educating on social media, just
The
because there's so much
surgeons.
nuance to it. Eh, I'm not a surgeon here. I don't have that
I'm,
mentality.
I'm
but
joking. But
but
I think it's mixed. I think a lot of physicians do say what they think it is, and the challenge is sometimes we're wrong, and we don't always have those caveats and mixtures. So that's an important component as well.
Definitely. I think the certainty, though, is probably a little bit less than other people who are not maybe as in the evidence kind
Mhm.
of mindset of doing things. And then it becomes a little bit more difficult when it's coming from higher authority figures, such as kind of the leaders of these organizations now. Not going to name drop in specific. I think you know who I'm mentioning. Is there something that the AMA is doing about this kind of dismantling of what we think of as evidence based healthcare?
Absolutely. We are advocating vociferously, both behind the scenes, as well as I think people can see in our numerous public statements about talking about the need for science, talking about the expertise of advisors, of working to ensure how do we continue to do many of these important functions. These are not, done in a day or 2 days, so it's taking time. But we have to stand up for physicians. We have to speak up for patients, and I take that very seriously. So there is a lot of work that's currently being done that is going to continue to be done.
Yeah. Thank you for doing all that work. I think it's important that it comes from kind of the voice of physicians, which the AMA is. Kind of coming back to misinformation and adding another part of why I think that's so prevalent is that seeing physicians is becoming more and more expensive. And unfortunately, that's due to insurance companies making it harder and harder to see physicians and get things reimbursed. So, thus, patients don't really want to see us because they know they'll get stuck with like a $600, $700 bill, maybe even more for whatever it is. And that often comes from insurance companies. So how has the landscape of insurance kind of changed, and how does the AMA interact with that?
Yeah, and one of the biggest changes is we're seeing this huge consolidation in markets where there's only one insurer, where there's only one large health system. And what happens with that, we see less competition. And when there's less competition, costs are going to be higher. So we're really trying to address how can we fight that? And one of the areas, as I talked about early on, is prior authorization, especially when there's consolidation and less competition. There's nowhere else that you can go. So you're subject to these systems. And we know that, recent data shows that about 29% of physicians report that prior authorization has led to a serious adverse event for patient
Mm-hmm.
in their care. And that's a real concern. And we know that, three-fourths of physicians say that patients abandon the treatment due to their struggles with authorization. So that's a very important component in terms of addressing prior authorization. And then, as I talked about, that we want physicians to be paid fairly. Um, Many physicians have had to close their practice over the years because they can't make enough to keep their practice open, an independent practice, because then they're not getting patients or they're not getting paid enough. So these are huge issues that we have been fighting for. And fundamentally, what people have to realize is this impacts access. That's what this is about,
Mm-hmm.
access and quality of care.
as far as access goes, all physicians hope that we can see more patients because that's what we got into medicine to do, is to help people. Unfortunately, it's becoming more and more challenging to do so on the terms that we want to see them on
Yeah.
versus someone else's rules. So I think this is one of the reasons that physicians like to get involved in the AMA so that their voices can be heard. What benefits do physicians have of getting involved in the AMA if they're not necessarily in the House of Delegates or they're making and
Yeah.
coming to these meetings? What someone like myself, who's maybe still a fellow, early career, what benefit do I have of getting involved in the AMA?
Yeah. And certainly you want to make your voice heard. So becoming a member and supporting advocacy and the efforts that we have is going to help the art and the practice of medicine. It's also recognizing our role in the education system, that you've had a great education and you want to make sure that that education system remains the best in the world. And the AMA fights for that. You want to make sure that you get paid fairly. So that's important to have someone fighting for you for that. It's all the aspects of the practice of medicine. Now, sure, there's, subscription to JAMA and other publications, and that's important, and that's CME. But fundamentally, it's you want someone who's going to be your powerful ally for the profession, and that's what the AMA is.
Yeah. What can individual physicians do to make a difference?
First of all, we want to become good clinicians, right? So you want to provide the best care that you can do, and that requires continuing education. You always want to get better. Mm-hmm. It's about advocating for your patients. So when you see issues of prior authorization, when you see issues of eligibility in terms of Medicaid that are problematic, you want to speak up. You want to talk to your legislature. You want to talk to other policymakers, and you want to have your voices heard, and you want to advocate for the profession.
Definitely. Well, Dr. Whyte, I want to thank you for the good fight that you're putting up on behalf of all of us physicians. We probably could have talked for a lot longer, but out of respect for your time, obviously being so busy, we're going to start to kind of wrap things up here. So the last question is always the classic. You've answered this in the past. If someone asks you to get healthy, you're a busy man, you only have 2 minutes to answer them. What do you tell them?
If someone wants to get healthy, now hopefully, I don't know what my answer was before, and this is something that I'm struggling with right now, but I do think one of the best ways to get healthy is to prioritize sleep, that we know the restorative value of sleep. But as we get busy, as we get stressed, sleep is the first thing that we kind of throw to the side, and we say we'll do it later. And that is not an effective strategy. So that's the big change that people should make that will make them healthier, even if they don't feel it right away, but they will soon enough, and may help them live longer and prevent or delay disease.
I think your answer has changed from the past, and that probably reflects your changing responsibilities and your role now. But Dr. Whyte, thank you so much for coming on and spending a little bit of your time this afternoon to come to this podcast.
Absolutely. I think what you're doing and helping to communicate important health topics is terrific. So thanks for inviting me back.